COVID cases are inching up in India again. 5,880 new cases have been recorded in the last 24 hours, and the total number of active cases have gone up to 35,199. In view of this, the Indian government has planned nationwide mock drills on Monday and Tuesday. This is to assess the readiness of the government as well as private hospitals. Mock COVID preparedness drills are underway in multiple cities today, including in Chennai in Tamil Nadu, Patna in Bihar, Jhajjar in Haryana, Bhopal in Madhya Pradesh, Ahmedabad in Gujarat and Hyderabad in the state of Telengana, as well as in Mumbai in the state of Maharashtra. These drills are taking place in Indira Gandhi Institute of Medical Sciences in Patna, in the All India Institute of Medical Sciences Hospital in Haryana's Jhajjar, and in the Rajiv Gandhi Government Hospital in Chennai in Tamil Nadu. Now, the Tamil Nadu Health Minister M.A. Subramanian is inspecting and overseeing the drills in Chennai. During the weekend, Central Health Minister Mansukh Mandavia had a virtual meeting with state health ministers. He proposed to curb the rising number of COVID cases by identifying emergency hotspots, monitoring trends of influenza-like illness and severe acute respiratory infection cases, ramping up testing and vaccination, and ensuring readiness of hospital infrastructure, ramping up of whole genome sequencing of positive samples. Those were some of the measures that the minister announced. Now, officials have said that India's Health Minister Mandavia will visit All India Institute of Medical Sciences University in Haryana's Jhajjar on Monday to oversee these mock drills. Last week, Mandavia had urged state health ministers to visit hospitals and oversee the mock drills. He also advised them to review the preparedness of the district administration and health officials. For more on this, we are now being joined by our correspondent Disha Shah, who's live from Mumbai. Thanks, Disha, for joining us. You're outside one of the hospitals there in Mumbai. It's one of the cities, Mumbai, that was the worst hit in the previous COVID waves. What's the level of preparedness now as COVID cases rise?
Well, certainly, as we all know, that the COVID-19 cases are increasing once again across the country, and we are noticing that three particular states, Maharashtra, Kerala as well as Gujarat, they have higher and maximum number of COVID cases. In fact, if you talk about the positive as well as the active cases. And keeping that in mind, the centre had directed last week to all the states to conduct a nationwide mock drill. And in India's financial capital city, Mumbai as well, we have seen in few of the hospitals, including private as well as government, we have seen that the mock drills have been conducted, and few of the hospitals have already sent their concerned report to the respective administration, that's the BMC. If you talk about overall Maharashtra, there are more than 500 such hospitals where the mock drill is planned today and tomorrow. Remember, Maharashtra was one of the states which was worst hit in the previous pandemic, and this time around they are really checking the COVID preparedness. In terms of that, of course, checking whether how many isolation beds are being kept ready, how many ventilator beds are being kept ready, how many isolated wards, because just in case if there is a spike in the cases and if there is medical emergency and if patients needs to be admitted, then whether the hospitals have enough preparedness or not. So what we understand in the next 2 days, not only across the country but few of the worst affected states as well are conducting their mock drills, and that report has to be submitted to the centre after the entire mock drill is conducted.
Disha, now the active cases all over the country are over 35,000. What's the central government's plan to arrest the spread of the virus? Also at the state levels, some states have brought back masking rules.
Well, certainly few of the states definitely have brought the mandatory mask rule. But if you talk about the biggest states, for example, Maharashtra, where I am currently, the mask rule has not been made mandatory yet, is what we understand. But yes, definitely advisories have been issued where the cases are high by the center as well as the states, that use caution where you're stepping out, especially at public places and where there is more crowding. Then usage of mask is advisable, is what we understand. As far as center's advice to the states is that to increase the testing, so that more people get tested at an early stage, then there are chances of less spread of COVID-19. That is one. And also genome sequencing, so that also should be increased, is what we understand. So all of these are few advisories that the center has really given to the states, and the states also at their particular medical level, they are increasing the testing. They are also ensuring that people use masks, especially at the crowded places. It's not mandate now, but advisory. And also people who do really fall sick, then they are being advised to consult the doctor immediately instead of getting treatment at home by themselves.
One final question to you, Disha. What are the medical experts saying this time? What's the severity of the infection and the rate at which it is spreading? Are doctors advising certain degree of caution this time?
Well, in the past couple of weeks, ever since the COVID-19 cases are increasing, we have been speaking to a lot of medical doctors across in private as well as public hospitals. And if you talk particularly about Maharashtra and overall India as well, what we understand that hospitalization is not much, so the severity is not much as we speak, so there is nothing to panic. Of course, active cases are more, but more of these cases are home isolation, is what we understand. But people need to be cautious. They need to be well taken care of when they step out at crowded places. So that is the biggest, of course, advisory. But hospitalization is very low. There is a full availability of beds across all the public as well as private hospitals across the country, is what we understand.
All right, Disha, we leave it there. Thanks very much for joining us with those details from Mumbai.